So good morning, everyone. It is Thursday. It's Coffee Talk Thursday. I'm so excited to see more lovely faces joining us. So thank you so much for participating in our weekly Coffee Talk sessions on Thursdays at 9:30. Just to remind everyone, please keep yourself muted. And if you have a question for our speaker, I encourage you to use the chat box. If you have a question for me or our speaker during our session, please use that chat box. And we are going to build in time for question and answers after each of our speakers. So keep those questions coming and just, be patient. And I promise we'll get all of your questions answered today. So I'm so excited to have a guest from our public health join us today. Her name is Nikki Todd, and she's with New Hanover County Public Health. I'm going to be talking about, of course, everyone's hot topic of COVID-19, maybe some myths that you guys have heard. Sometimes people say, there's a cure-all for this or that. And so Nikki's going to be going over what is happening in the world of public health right now, and also talking about some myths. So Miss Nikki, take it away. Thank you so much for being here.
Oh, you're quite welcome. It is a real pleasure to be here. And of course, like you said, that's what everybody's talking about now for everything. Everywhere you go, it's COVID, which is, what we need to be thinking about because it is out there. But I know, Kelly, you sent me a couple of questions yesterday to kind of start this off to see, just give everybody a heads up on kind of where we are. So the first question you had for me was what phase we're in. Well, currently we are in phase 1 and 2. And so that's healthcare workers and people in long-term care facilities and people 65 and older. But we just got some new guidance yesterday. And so February the 24th, we're going to be in phase 3. Phase 3, which that's going to be people that are teachers, people that are in the school system, those folks, they're the ones that are going to be in the phase 3, and that starts the 24th of February. And so everybody's pretty excited about that. So, like I said, currently we're doing healthcare workers, phase 1 and 2, and long-term care staff and residents and people 65 and older. And they will still continue to be prioritizing those folks too. But like I said, beginning February 24th, we're going to be moving into group 3, which is frontline essential workers, school and childcare. Those folks that are very important as we're trying to, decrease the spread of this virus in very populated areas. So that'll be beginning February 24th, and it'll be pre-K through 12 in schools, and also these essential frontline workers, and how you are going to be determined if you are eligible for this in any of that phase 3. If you're in a child care setting, are you in pre-kindergarten programs? Are you in Head Start or early Head Start? And preschool programs and family child care homes, and these traditional public schools that we have, and also charter schools and private non-public schools. Also, we're going to ask what your role is. Are you a teacher? Are you assistant? Are you do student researching? Are you your owner, director? Are you a supervisor in these schools? There's a whole list of questions that we want to know to make sure, that you are in an essential worker and work in school and childcare. So that's where we are in phase 1 and 2 right now. And like I said, February 24th, that's a big day. We'll be opening that up. So that's really good. And some statistics, Kelly, you were asking about some statistics. And we do have some, and I'm going to give those to you right now. I'm very impressed, and when I give you these numbers, you're going to be impressed too, because it's really amazing what we've been able to do. Let me get my numbers for you here. So as of February 9th, public health has vaccinated 11,139 people with their first dose, and 7,469 people with their second dose. So of these 18,608 vaccinations, so that is amazing what we've done. So 11,139 people with their first dose, 7,469 people with their second dose. So also we have been partnering with other healthcare entities, facilities, and so more than in the community, 36,586 total doses have been given. So this is updated every week, and you can go to our website. And Kelly, what I can do is I'll send you our website information and all the updates and where people can go on and sign up to get a vaccine. And you can go on to, what I've been telling people, what we've been hearing is there's a link you can go to on our website that says for you can get alerts. And so when you sign up for that alert, when the appointments come open, you can start calling right away. And so we understand totally, public health, New Hanover County understands totally how difficult it is to get an appointment. But what's happening is we are only allotted so many vaccines a week. Like the last 3 weeks, we've been getting about 300 doses, and that varies. That's our baseline. So sometimes if the federal government has extra vaccine, they'll bump us up and we'll get more vaccine. And that's why it varies so much, because we are doing appointments, which is working very well. When you come in, you don't have that much of a wait. I know in the very beginning, before we started doing appointments, you would come and have to wait for a couple of hours to get in, and it was just difficult, and it was not working out very well for the public. And we just wanted to make it a little easier and less stressful. So we made appointments, and now you can also do online appointments. So Kelly, I will send that information to you, and you can pass that out to the folks there at the senior center when it's convenient for you to do so. Okay, so another question you had was, what locations are we doing vaccine right now? Well, we have been doing vaccine there at the Senior Resource Center, and we've been doing that from like 12:30 or 1 o'clock to 7 or to 6. And that's going to be varying, the days vary. And so we're also doing Martin Luther King Center, and those hours vary too as well. So what's happening is when you go onto this website, our website, it'll tell you, when we're doing those vaccines, where we're doing them, and the times. But 9 to 5, 9 to 4 at MLK is what we're doing currently. And that's where we are today. We're at the MLK Center today and tomorrow. And so we'll be there from 9 to 4. So we're doing a lot of vaccines out there. And also we're doing vaccines. We're getting out into the community and doing outreaches. So we're going to those marginalized communities where it's difficult. Folks have difficulty getting here. And so we are out there as well, trying to get out there and reach those folks at different sites. Also on our website, it'll tell you that you can go to New Hanover. On our website, it'll say New Hanover Regional Medical Center is also getting vaccine, but it's like us. It's like on a limited basis. You'll have to, when you get on our website, there's a link for New Hanover, and it'll tell you if they're doing vaccines now, if they, excuse me, if they have vaccine available to them. So that's another place that it's possible for you to get the vaccine. And so let's talk about the vaccine right now a little bit, and then I'm going to give everybody a chance to ask me some questions. I'm just going over some things that I think that you guys might be interested in. which is the vaccine. So it's 2 doses. We have two different manufacturers of vaccine. One is Pfizer and one is Moderna. Everybody has heard about that, I'm sure. So the Pfizer vaccine, and all of these vaccines require 2 doses. So the Pfizer vaccine, you get dose 1, and you start getting some immunity. Your body produces antibodies to fight this COVID virus. As soon as you get that vaccine, you're going to get some immunity. You get some immunity in 2 weeks from that first Pfizer vaccine, that first shot. You'll get after 2 weeks, you'll get 82% coverage protection, and after you get that second shot, you get 90% coverage. And that Pfizer dosage, you get one, and then 3 weeks later, 21 days later, you get the second dose. And 2 weeks after that second dose, you should have full immunity. And so the other vaccine is Moderna. And the first shot you get, you have 80% coverage 2 weeks afterwards. And then after the second shot, 2 weeks after that second shot, you get 94% coverage. And so some of the side effects that you might have from that is, and it varies from person to person, you may have a headache, you may have muscle aches and pains, you may have a fever, you may have some chills, but typically people do very well with the vaccine. You're going to have some of those systemic reactions to the shot. And so the Pfizer vaccine, you can get that when you're 16 years and older. And the Moderna vaccine you can get if you're 18 years and older. And what we tell people is we don't want you to get the vaccine 4 days earlier than what you are required, what the recommendation is. Just like if you have Pfizer and it's 21 days, we wouldn't want you to come 4 days earlier than that. You can come, greater than 4 days. You can get it 4 days early. Either vaccine, you can get it 4 days early. Moderna or Pfizer, you can get it at least 4 days early. If you cannot, come back in the day that it's recommended that you do. And we know sometimes, you have appointments, you're sick, you're out of town, emergencies come up and you can't get the vaccine. But what we are telling everyone is please come back as soon, not as soon, but as soon as your immunization card tells you to come back. 28 days for Moderna, 21 days for Pfizer. That's the best coverage you're going to get from that vaccine because that's what the research tells us. So we don't want you to come any earlier than 4 days before, but you can come up to at least 45 days afterwards. We're not telling people that that's what you can do. We want you to make it a priority to get in here when what the recommendations are from the CDC and the state for you to get in here to do that. When you come to get your vaccine or when you receive your vaccine, you'll be given an immunization record, and it'll tell you your name and your date of birth. It's a nice little card. Some of you have already received the vaccine, I hope. I hope some of you already have. But you will receive immunization record, and it'll tell you your name. It'll say your birthday, and it'll say what kind of vaccine you got, whether you got Moderna or Pfizer. There'll be a lot number there, a lot number that you received, and it'll say where you received it. And when you turn the card over, it'll tell you when you need to return. And we tell everybody to please, keep that card, take very good care of it, and make sure that you bring it back when you return. Now, when you get your second dose, what's happening is someone will call you and let you know or email you. Typically, we're getting your emails. We're asking for your emails, and so we're emailing you with the time to return for that vaccine and where to return. If you got it at MLK, or if you got it at the Senior Center, or if you got it at HHS here, Human Health and Services, we would want you to come back to those places of where you received it. But if you can't, you can let us know, and we're certainly not going to turn you away wherever you show up. But that helps us keep good track of our inventory about, you have appointments and we're going to pull those shots out. So, what else, Kelly? Let me see if there's anything else. Um, this virus, this vaccine that we're giving you does not give you COVID. It is not a live virus. So what it's made up of proteins, and what it does, when you receive this vaccine, your body's going to recognize it as to build antibodies against this virus. That's how it protects you. It's your body is producing antibodies against that. And so we just got some new guidance today. I know people are asking us, well, suppose I've had COVID, do I still need to get the shot? Well, when you have COVID disease, you have immunity up to 90 days. Now, we're not going to turn anybody away. It's up to you if you want to get the vaccine before that 90 days. We're going to leave that decision up to you. It's the CDC and the state are saying that's a decision that you can make. It's up to you if you want to go ahead and get it. We're not turning anybody away. We're trying not to turn anybody away that's eligible for the vaccine and that can take it, without any serious side effects. So that's one thing that we want to make sure that everybody understands, that if you've had the vaccine, if you've had the disease, you're welcome to get that vaccine, but after you do have COVID, you are immune for 90 days. That's what the research tells us. So, yes, something kind of exciting. It's really, we're excited about that. So, let me see something else. I already told you how to sign up for alerts and updates. And I told you about the locations. So, what else, Kelly? What other questions would you have for me?
Heidi, I know you just mentioned if you've had COVID that you can still get the vaccine. Do you guys have a recommendation on, should they wait a certain period of time before they get that vaccine? I know you said they're immune for the 90 days, but do you have a recommendation if they should wait that full 90 days, or does it matter?
Well, that's what the CDC is telling us. It's up to, you're gonna be covered. You're gonna be covered 90 days after you have COVID. And if you're in that phase where you want to get the vaccine, because we've had folks come in several times and will, just like I'm telling you, that would say it's up to you. You are protected. So, um, you might have a little more side effects if you get the vaccine, but there's no, this virus is so new and the research is changing all the time. And we're getting new guidance all the time, but the latest guidance is it's um, it's what you choose to do. If you want to go ahead and get the vaccine while we have the vaccine, and while you're here, and while you're in that phase, you can certainly do that. Okay. Any other questions?
Thank you. I do have a few other questions.
Okay.
What is the most common side effect that you see that most people are having at this point? I know you said everyone's a little bit different, of course, but is there a real common side effect that you guys are seeing?
Well, we know that you're going to have a sore arm where you get shot. It's just like you get any other shot. But when I had my shot, I had a sore arm. Tetanus shot is pretty much about the toughest shot you can get for side effects from what I've experienced personally. And this was a little bit more than a tetanus shot, but it went away in 24 hours. I didn't have any other symptoms, but some people are having headaches, headaches and fatigue, and just a general blah feeling, you know. But like I said, and also we've heard that the older generation, they don't have as many side effects as the younger folks. And so I heard somebody say the other day, and that's said because the older generation is tougher. you know, but I thought that was pretty funny. But headache, really. I gave some vaccine yesterday, and people are calling to me and telling me that yeah, they have a headache and they have some little muscle aches and their arms are sore. And some people have chills, like I said, and some people will run a fever for 24 hours. But typically, the symptoms will go away in 24 to 48 hours, and you're good.
I do see Miss Gwen has her hand raised. I do have a few other questions that people have sent me in the chat box. But Miss Gwen, I'm gonna ask you to unmute yourself and please go ahead and ask your question, okay?
Hi, Gwen.
Good morning.
Morning.
My question is, uh, compared to the Pfizer and the Moderna shot, uh, one is more effective than the other, because I think I heard you say that the Pfizer was 90-some% and the Moderna was 80-some% effective.
Well, the first shot with Moderna, after you get the first shot, you have 80% effective rate a couple of weeks after that. And after you get the second shot, 2 weeks later, you have 94% effectiveness. Now, the Pfizer, for the first dose, you have a little more protection. After the first dose, you have 82%. And then after the second dose, you have 90% effectiveness. So that's still pretty,
Okay.
that is over 90% effectiveness in any vaccine. And no vaccine is
Right.
100%. So when you're in the 90%, you're doing really good. So, and you have no choice. You have no choice when you get here, whether you're going to get the Pfizer or the Moderna. We're going to give you what we have, what we've been allocated that week. And when you get the first dose of you're gonna get the same dose, the second dose. If you get a Moderna the first dose, you're gonna get a Moderna the second dose. But if for some reason you do swap that out, that you get the Moderna and a Pfizer, it's nothing gonna happen to you. You're still gonna get coverage. We're not gonna redo the vaccine. There's no need for that. But they like to, the research has been done for Moderna, Pfizer. But they are telling us that if that happens, that you do not have to get a third dose. Okay?
Thank you.
So Nikki, if people have recently gotten, another vaccine, say like a pneumonia shot or something like that, do you know if they need to wait a certain time period before getting a COVID vaccine? Does that interact with each other?
Yes, I meant to mention that. What we're going to ask you is if you've had a vaccine in the last 2 weeks. So we don't want you to get a vaccine. We don't want you to get a pneumonia shot on Monday and come get a COVID shot on Tuesday. Because the research tells us they don't know how that interacts, the two antibodies interacting against each other. So that's what we're going to ask you. And we're going to ask you if you ever had an anaphylactic reaction before with the shot, which means with any shot, if you have difficulty breathing, if you've had to use an EpiPen, that sort of thing. And after you get the shot, we're going to ask you to wait 15 minutes so we can watch and see how you're going to do. And if you've ever had an anaphylactic reaction to a vaccine, we're going to ask you to wait 30 minutes. So, and also if there's any question about, whether you should receive the vaccine or not, we always are asking you to check with your doctor if you have, extenuating circumstances about the vaccine. But vaccine doesn't interfere with any medication that you're taking, anything like that. So everyone is eligible unless you've had an anaphylactic reaction before. I see George has a question. Hello, George.
Good morning.
Morning.
I got like two questions in one. Do younger than 65-year-old people get the shots early if they are caregivers for their parents and they have to take their parents to get the shot? And my second question is, how is it decided that schools are safe for teachers and kids if teachers have not had the shots?
Well, as you know, George, I am not the governor. I am not the governor, and I am not a researcher. And so my question is like yours, but they're telling us, well, let me read it. I got it right here, George. All right. Let me see what the governor said. Says, well, I wanted to tell you too that North Carolina has administered 1 million first doses. Isn't that amazing? And the second dose we've administered, North Carolina, is 1.5 million. So let me find here what the governor says. So what they're basically saying is, even though they are saying that teachers don't have to be vaccinated to be in the schools for protection, so what they're saying that if you can social distance in the school, and people wear their mask, everybody's wearing a mask, and you're doing the 3 W's as much as possible, that you can safely be in school now. So, and that's going to increase more because, like I was saying, the more people that have the vaccine, they are protected. The more people that have had COVID, they are protected. So there's a lot of folks. We've got over 14,000 people in New Hanover County that have had COVID. So that's a lot of protection. That's 14,000 people. And some of these are school students. Some of these are teachers. So what they are saying is that when you get back into the school environment and you practice those guidances, those control measures that the president has put out, that the governor is telling us as well, that it is safer. It can be safe. So I'm sorry, George. That's my answer. I can't, we're following the guidelines there are risks out there, and we just have to make sure that we're doing everything that the research tells us that will stop this spread and keep our risk low. Keep our risk low. So that's
a couple more questions for you, if you don't mind.
That's not a complete answer, but okay.
I understand you're limited on your response, so I think George would understand that. So recently, we saw in the CDC that the CDC says if you're fully vaccinated and you receive both of your doses and you're exposed to someone who had COVID, that you don't need to quarantine. Is that true?
That just came out this morning.
Okay.
Amazing, yes. If, and I have that, I copied that because we're so very excited about this. And this is from our state medical director. He sent that out this morning. So what he's saying is that if you've had an exposure and you've had COVID within 90 days and you are immune, if you're a close contact, you do not need to quarantine. Also, it came out this morning that if you are here it is right here, and I'm going to talk about I'm going to talk about masks too, about the layers of masks that you're supposed to wear, but it says this is updated quarantine guidance for vaccinated people. So states that if a vaccinated person has an exposure to somebody who's a suspect or confirmed case of COVID, they are not required to quarantine if they meet these criteria. If they're fully vaccinated, so 2 weeks following that receipt of the second dose, or 2 weeks following receipt of a single dose. So you won't have to quarantine if you're vaccinated, if you've had 2 doses or if you've had 1 dose, and you are within 3 months of the last dose that you had. So it's extending that out, and you are asymptomatic after your exposure. So some people, when they've been exposed, they're asymptomatic all the way around. So that's good. So and it goes on here. It's different for if there's an exception if you work in a nursing home or if you're in a long-term care facility. But for the general public, that's what that is. And also, if you've had the disease and you come in contact with somebody and you're asymptomatic, of course, if you're symptomatic, you need to stay home. You know, if you're symptomatic, you need to stay home. But if you're asymptomatic, it says that if you've had the disease within 90 days, you don't have to quarantine. That's a very good question. I just got that answer this morning. Whew.
Ooh, I'm glad you're on top of things. So another question I have, as I think I mentioned at the beginning of our session, there are so many crazy myths out there that I've read online, and I'm sure lots of our viewers have, heard about crazy things, cure all, like home remedies and things like that for COVID. What's like some of the biggest myths that you've heard out there?
Well, some people say that COVID is just not as bad as we think it is. But of course, our numbers and our data speak to that. And some people say, well, I'm gonna drink a lot of orange juice, euthanasia, and vitamin C, and I'm going to, take some herbs and stuff. Of course, there's nothing like that we would ever say that you need to do instead of taking the vaccine. But of course, healthy lifestyle. Once you get the vaccine, we ask that you eat healthy, stay hydrated, get rest, and, just take care of yourself. But myself giving a lot of shots, I haven't heard anybody's, well, we've got a couple of things like I just mentioned, but there's no really any wild myths out there that come to my mind. But all those things that you read, it says, if they're healthy, eat healthy, stay hydrated, and do all those things that you know to do, that you learn to do in health class. You know, I don't think we should do anything overboard. We don't need to do anything, not as much as we should. We have to have a balance in what we're doing there.
Definitely. Nikki, and your, if you could just share with us, I like to ask all of our participants this question, our speakers, and I think it's really important for everyone to know that we're kind of all in it together, but how has the pandemic changed you, either in your personal life or your work life? I know, of course, that has been drastically changed, I'm sure, but if you want to share anything with us about, how it's really changed you.
Oh, well, that's such a good question. And my supervisor, Carla Turner, she sent out something to us. I'm going to try to pull it up here. About some of the things similar to what you just asked, some of the things that you're grateful for are realized more since this pandemic. And what I wrote was, send it back to her, was just what I've missed the most is my family, of course, seeing them as much as we used to do. But like at Christmas time, I missed we didn't have Thanksgiving, we didn't have Christmas, we had distance, I cook for everybody. That's what I do, is cook for everybody, cook for my family, and I took plates to them. We didn't have anybody over, and we took our gifts over. But in what we did, we FaceTime when everybody was eating, but that wasn't the same. But what I've missed the most, and how it's changed me, it's made me appreciate those things that you always took for granted, just like not wearing a mask. Seeing people's faces, and everybody's hidden behind a mask, and it's hard to recognize people that you work with. If you see them in a different place and they got a mask on, you have to go and look twice and say, is that who that is? Those things it's changed. I appreciate so much more walking around freely without a mask. And I appreciate those hugs that you get from your family, and those special times that you have that we've not been able to do. And professionally, this is like hurricane mode for a year, because we're incident command here. We have a command center, and we're doing everything by the incident command format. And so everybody in this county, of course you guys know that, everybody in this county is on board 100%, because it's taking everybody to organize and to get the vaccine in and get it out, get the data in, and get all of the information in that we have. The state, what it is, it's the federal government, the state government, and the local government collaborating, coordinating to get us out. And it's, to me, we've done an amazing job. Now, I know there's a lot that we could do better, but with what we have and how we're trying to disseminate all this, it's amazing. I wonder sometimes how we do it. But the New Hanover County folks here and everywhere, I'm talking about all areas, from the county manager, the commissioners, right on down to everybody that is employed anywhere as a county employee, they're involved. Anybody that's a county employee is involved. So that's that's what it's basically has changed me professionally, that I appreciate so much what everybody's doing, and you don't realize what you can do and how you can get things done until you go, okay, we got to get these shots in people's arms. How are we going to do it? How are we going to do it? We got to get these shots. People got to get the shot. So that's my answer.
Thank you so much for sharing that. And it's so true. You guys are, just like you said, an emergency crisis mode that you've been dealing with for coming up on a year now. And we greatly appreciate your hard work and dedication to our community for sure.
Well, we've got some amazing citizens in New Hanover County now. I'm telling you, we get so many good compliments. I mean, really, everybody's appreciative. Of course, we get some people that, that can't understand, a lot of things that we're doing, how we're doing it, and they can't get a shot right away. But eventually, we're going to get everybody a vaccine eventually. But overall, it's been a really awesome experience. Really, none of us, I don't think anybody in New Hanover County, citizens, employees, whoever you are, we're going to learn from this. We're going to come out better because we appreciate things more.
Absolutely.
I
Well,
see-
Nikki, thank you so much for taking a few minutes to share with us this morning what's going on in your public health world, and to answer some of our COVID questions. I think that I've learned a lot this morning, and I hope that everyone else has too. So again, thank you so much for joining. And oh, hold on, I think Mr. George, you have another question for Nikki before she goes.
Hello, George. You're muted. Can't hear you.
It's basically a comment, not a question. I've had my shots, and I want to say that the experience I had getting the shots were great. I had no problems. I was blessed that it wasn't long lines, but I felt like everything, all the operation was great. Everything moved real smoothly and everything.
Well, good. Well, I thank you for that. We'll take all those kudos anytime we can get them. Well, listen, it was my pleasure to meet you guys this morning, and I hope I was helpful in answering some of the questions. And really my pleasure to be an advocate for you and to give out as much information as it becomes available. We are sending it out. And Kelly, I'll send you, or do you already have that information? Can you go on the website and pull up the alerts and forward it to your folks?
Absolutely. Yes. And I'll share my email and phone number with them at the end of our session today, just as a reminder, if they have any follow-up questions or anything, I'm glad to get them to you that we can answer them for them.
All right. Well, listen, y'all have an amazing day.
Thank you, Nikki, so much.
Okay. Take care. Bye-bye.
Bye-bye. If everyone else can just hang out with us a few minutes, I just have a few follow-up exciting, information to share with you guys. So thanks so much for hanging out with us. So right now I'm going to take a moment to introduce Ellen Connor. I'm sure everyone recognizes her face, or I hope you guys do. She's our nutritionist here at the Senior Resource Center, and she has an exciting announcement to make.
Thank you, Kelly. Can you hear me okay? Okay. Thank you for allowing me to talk about our new virtual cooking demonstrations. So in the past, I have done cooking demonstrations here at the Senior Resource Center, but of course, with us being closed, did have to cancel those. But actually, I'm very excited to be teaming up with Ryan Gibbs. He's our contract caterer here at the Senior Resource Center. He does the home delivered meals and the drive-through meals for us here, providing those to our seniors 5 days a week. So Ryan and I go way back. We've probably worked together off and on for 7 or 8 years. So we do have a really good working relationship. We thought it would be fun to join forces together to bring some cooking ideas your way. So beginning next Thursday will always be the third Thursday of the month. So next Thursday is the 18th, and between 1:30 and 2:30, we will be Zooming into your homes to provide you some type of cooking experience. So I know next week, Ryan has planned kind of a home cooked dish that is comfort food, that is easy to prepare, that's economical. So, what more could you want? So that's what we'll be doing next week. And just so you know, our format is not set in stone. We're kind of wait and see how it evolves, and listening to the participants that might be on the program with us to see what you might like. There's been some talk of maybe a competition. I don't know. I think about that, but then I'm thinking if I'm going to compete with a chef, that's a little unnerving for me, but I haven't excluded it completely. So we'll just kind of see where it plays out, but we're hoping that you will join us and see what, my light always goes off, and see what we can bring your way every month. So very excited about that.
Great, thank you so much. And I encourage the challenges. I think it would be really entertaining to watch. I know lots of people enjoy those cooking, shows on TV where they're all competing against each other, competing against the clock sometimes, to come up with new and creative ideas. So I know you guys are going to do a great job.
Well, it will be fun. I just don't want to do anything that might do disrepair to our working relationship. So we still have to work together Monday through Friday, but and it wouldn't. We get along quite well. So really looking forward to it. Do we have anyone on this morning that does enjoy cooking?
You guys are welcome to wave. Do you guys enjoy cooking?
Yes. Okay. Well, the thought is that, whatever your interest is, if it's something really simple that you want, then maybe you really don't enjoy cooking. So you need just those really, those simple things that go together quickly. We'll do those. Or, if we're into, different cuisines and different ingredients, maybe we can show some things that maybe you haven't ever tried before. So, it's kind of a clean slate as far as how we will move forward with this.
That's great. Thank you so much. So again, that is going to be her first cooking demo on Zooming into your home. I love that lingo, Zooming into your homes. Will be next Thursday at 1:30. So we do have Coffee Talk Thursday on Thursdays as well at 9:30 a.m. So just, stay the whole day with us.
Absolutely.
Thank you, Ellen, for taking a few minutes to tell us about your cooking demos. I know they're going to be fantastic.
Yeah. And actually, I did want to point up too that when you were asking about, and I don't know how, I guess we got a little bit more time left.
Sure.
Okay. Asking about how COVID has changed everyone. And certainly it has changed us here at the center. And with my nutrition program, we are serving many more participants than we did prior to COVID. We're doing the drive-throughs. We normally utilize about 98% senior volunteers. So that has been a challenge during this time. So we've really met those challenges and still able to provide the services to everyone. So it's just like every other workforce, there have been definite changes that have needed to be made during COVID, and so that's worked out. But what I wanted to point out, because it is, Coffee Talk. Oh, can't see it. There we go. So this is my, okay. This is my coffee cup. Well, you can't really see it too much for some reason. I guess, there we go. But anyway, in COVID, I became grandma for the first time twice. So, which has been very exciting, and everyone here at work knows my grandbabies as well as I do pretty much, but because of all the pictures I keep sharing. But it has been a challenge, and to not be able to hold them, to see them, to watch them grow over something like Zoom. So, but I'm very thankful to have that here, that we can at least be connected that way. And one other thing I wanted to say with that is to see everyone's smiling face, you know, because we don't see those anymore. And I try to make sure people know I'm smiling by my eyes, but sometimes, you know, you can't always see that. So it's really nice to see smiles in a setting like this. So thank you.
Thank you so much, Ellen. It's so true. It has changed all of us. And I think it's important for us all to realize that we're definitely all in it together.
Mm-hmm.
Well, during each coffee talk session, I always bring up seniors in the news. And I recently read this story. It's about 2 seniors, but I'm going to read it to you guys. It'll just take me a few minutes. Really, the message is so important. So here goes. So this is a senior that actually was talking about, you know, several years back being a taxi driver. So it says, one time I had to pick up a passenger in the middle of the night. When I arrived at the address, the building was dark except for a light in a ground floor window. Many drivers would wait for a couple of minutes and drive away in such circumstances, but I thought of passengers that may need my assistance. So I always went to the door and knocked. So I did the same thing this time. I went to the door and knocked, and I heard a weak voice of an elderly woman. "Just a minute," she says. The door opened, and I saw a small lady in her 80s wearing a dress and a small pillbox hat. She had with her a small suitcase in her hands. So I took the lady's suitcase and I helped her walk to the cab. "Thank you for your kindness," she says. And I said, "It's nothing. I just treat my passengers the way I would treat my mother." And she says to him, "You're a very decent person." When we got into the cab, she told the address that she wanted to go to. And then she asked, "Could you drive through downtown on the way there?" Well, I told her that's really not the shortest way. And she said, "I know, but there's no rush as I'm on my way to hospice. I have no family left." And then the gentleman saw tears in her eyes. He decided to quietly switch off the meter and asked what route she wanted him to take. They drove through the city and she showed him the many places that were important to her in her life. The building where she worked as an elevator operator, the house where she grew up and where she married her husband, and where they lived their life, a warehouse that was a ballroom many years ago, and she used to go dancing there when she was a young girl. After 2 hours of driving, she silently said, "I'm tired, let's go now." As soon as we arrived to the address she gave me, 2 orderlies came out to the cab. They seemed to be waiting for her. I took the lady's suitcase while she was seated in a wheelchair, and she asked me, "Tell me how much I owe you." I said that she owes me nothing. "But you have to make a living too," she said. "There are other passengers," he said, and he gave her a hug. She held on to him so tightly and said, "Thank you for giving me these moments of joy the past few hours." When he was walking back to the cab, he heard a door shut and he thought to himself, it sounded like the closing of a person's life. So that day, he didn't pick up any more passengers. He just drove around without any purpose, lost in the thoughts about the lady that he had just spent the few hours with. You know, really, and he ends his story by saying, "We always look for great moments, but sometimes great moments catch us unaware, beautifully wrapped in what might be considered as nothing particular." And isn't that so true? that you never know when you're going to make a difference in the life of someone. And so my challenge for you guys this week is something small. It doesn't take money to make a difference in someone's life, as all of you know, and have experienced. Some gesture, some small gesture of kindness goes such a long way. So I encourage you to think about, how can you make a difference in the life of someone without spending any money? So next week, when you all join me again, I would love to hear what you've done this week to really step out of your comfort zone and really think about how you can help others in our great community, especially right now when we all need it so much. So thanks again for joining me on Coffee Talk Thursday. I hope you join me again next week. We're going to have another special guest, and I promise it'll be very educational. Again, my name is Kelly. I am one of the program managers here at the Senior Resource Center. If you have any questions or comments for me about today's topics, or if you have suggestions on future topics, my direct phone number is 910-798-6403. And I hope to see you all next week. Bye.